All right, tell us about our special guest we have in studio.
All right,
here.
we've talked about bugs, we've talked about baptisms, we've talked about bubbles, we've talked about everything, but joining us now is Dr. Kim Lentz. She joins us every year because we've been talking about ticks and Lyme disease. And if you go outside, you think, it's my yard, I'm just on the property, or maybe I just
I'm
walk
in
through
the
the woods.
city.
I'm in the city. It doesn't count, does it, Kim?
It does count.
You about hit her in the face with that microphone.
Well, she was about 4 foot away. She didn't need those front teeth anyway.
Right.
All right, so Kim, ticks are everywhere.
They are everywhere.
Yeah.
Doesn't matter if you live in the city or in the country, or there are ticks all over the place.
So just from digging into our childhood, there was always ticks, but it seems like it's gotten a little more serious.
Yeah, I think at least when I remember growing up, all I really saw were dog ticks.
The big ones, that's
Pull
right.
the big ticks off of your pets, and those carry some disease, but now it's more of a problem with deer tick and Lone Star ticks, particularly in Indiana.
Whoa. The Texans are in this? Lone Star?
Actually, I don't know why it was named Lone Star, because I think they originally were in southern Missouri.
Oh.
And they've kind of migrated up into Indiana, especially southern Indiana. People who live in southern Indiana will tell you that's
So when we grew up with
what
dog ticks, we could remember back behind the ears, we'd see a dog tick and sucking blood, and all of a sudden it's really, really big.
Correct.
Uncle Wallace would come over and he'd just grab it, yank it off, or he'd light a match, let it burn down, get red hot, and then he'd touch the butt of the tick to make it back its head out. How do you get rid of a dog tick?
The best way to remove any tick is with either a tick removal device, like something called a tick key, or fine tweezers. You grab it at the base, you gently pull up until it releases.
So you don't jerk it out.
You don't jerk it out. You want it to let go because you don't want the head to stay in. If you pull too hard, you'll detach the tick's body from its head. And so
I have that problem with Pat.
You don't.
So what would happen? I mean, is that?
Well, if the head is left in, then it still is access to your bloodstream, and so it could continue to drop infections into your bloodstream if you don't remove the head. So you don't want to burn it. You don't want to put nail polish on it. You don't want to. You basically need to try to get the whole tick removed.
Wow. I remember my son, we would go down to Uncle Russell's down on the Ohio River, and he had mules, or he had donkeys. And I never thought of horses having ticks, but they absolutely do. And that little guy got something right on the inside of his thigh up close to his goodies. And I had to come at him to pull that off. And he wasn't Andy was not interested in that at all.
Right, I bet he wasn't.
So, but the idea is to get a hold of it, pull gently until it pops out.
Till it releases.
Yeah, I wish I'd remembered that when he was a little boy.
Yeah. Yeah, I think ticks are probably on most animals. They don't necessarily make the animal sick. They don't always, like, you think a deer tick is on a deer and deer have Lyme disease, but they actually don't. They carry it, but they don't get sick from it. And same thing with horses. And although dogs do get tick-borne diseases.
So how long has the Lyme disease part of this? Because again, I don't remember. Was there Lyme disease when we were kids?
So it really was the organism that causes Lyme disease really was not identified until the early 80s.
Okay.
So when we were growing up, it was probably here, and people were probably sick from it, but nobody knew what it was, and it wasn't until in the 80s it was named after Lyme, Connecticut. There was a big group of children in Lyme, Connecticut that had been diagnosed with arthritis, and the parents were like, that's really weird. How can all of our kids have arthritis? And then they started to do investigations into that, and they identified the spirochete that causes Lyme disease.
Indiana Lyme Connect, that's where people are supposed to connect and coordinate everything through if they have any suspicions?
So Indiana Lyme Connect is a nonprofit organization here in Indiana with the goal of educating the public and physicians on Lyme disease and what to look for. So the website is very helpful. It tells you what to do before you go out. It tells you what to do when you come back. It tells you how to protect yourself. It tells you what kind of symptoms to look for. And it has all kinds of information about Lyme disease. It's a pretty extensive webpage, and you can get a lot.
So what are some of the symptoms? So let's say that you have one of the kids, 13-year-old
right.
that takes a shower, the tick is gone, but then he has symptoms.
Right. So symptoms can start days to weeks after a bite. Traditionally, we were taught that everybody has a bullseye rash, but only about 30 to 40% of people who have Lyme disease will remember having a bullseye rash.
Really?
If you have a bullseye rash, then that means you have Lyme disease.
Tell them what that is, a bullseye
So,
rash.
A bullseye rash is like a red circle, then a clearing around the circle, and then another red circle.
So
around
like
it.
a bullseye.
Like a bullseye.
It looks like a bullseye.
That you see,
Right.
that
Hello,
was pretty
Mr.
logical.
Obvious.
I wanted
So-
people to know, because some people don't know what you talk about.
Yeah.
Yeah.
So symptoms can be varied. People can have fever, they can have joint pain, they can have headaches. They can even have neurologic symptoms where they have a lot of brain fog and they don't feel good.
gosh, I just thought it was old age.
It can happen. It can cause a wide variety of symptoms. So you have to just be aware. And if you've been in a place where you could have gotten bit, even if you didn't see the tick, to know in the back of your mind, I wonder if I could have gotten bit, because the nymph ticks are the size of a poppy seed. And so it would be easy to get bit and not see it.
Is the Lyme disease like a blanket for different, I mean, are the symptoms always the same? It
They are
doesn't
not
sound
always
like
the
it.
same.
So is it this just is there different types of Lyme disease?
So the problem is that Lyme disease is one specific infection, but ticks carry other things. So they carry Babesia, and they carry Anaplasma, and they carry Ehrlichia, and people don't know as much about them, and they do have a little bit different symptomatology. You know,
We flew Ehrlichia to Dublin.
To
Did
Dublin.
you? Yeah.
Yeah.
I
All
bet
right,
you did.
so
Direct
there
flight,
used
you
to be
know.
an, and I cannot remember, one of my plumbers came in and actually had the bullseye rash, and I said, hey, have you had that looked into? There used to be a very simple regimen of antibiotics. Is that still the protocol?
So the protocol currently is you would get 2 weeks of doxycycline after a bite.
Doxycycline, that was it.
That for some people is enough, but for some people it's not enough. And the main reason is that the Lyme bacteria specifically grows very slowly. So it only replicates once a month, and antibiotics work by making it not replicate. So if you take an antibiotic for 2 weeks, you could miss some.
Miss that window.
And so we recommend somewhere between at least 4, maybe 6 weeks after a bite. And doxycycline would cover everything I mentioned. So it would cover Lyme and Ehrlichia and Anaplasma.
Does it help acne?
It does help acne.
I did. See, there you go, Pat. We're saved.
Wow.
You know?
And so doxy's a good first choice. And so sometimes, people want to get tested. You have to wait a little while. You don't test positive immediately. It takes 10 to 14 days after
This is a
bite.
devil disease. My gosh, hides under the
It's-
covers and then you don't even know you've got it.
Right. And then if people don't get treated adequately, then they can have problems down the road. So about 20% of people who get Lyme disease can become chronic.
All right. Many of our listeners are gardeners. Pat runs a greenhouse,
Yeah.
a nursery. Do they need to be suspect? I mean, do they need to be cautious too?
They do. I mean, there are really easy ways to protect yourself, because you can treat your clothing. You can obviously use bug spray. So
You're talking about DEET or are you talking about sulfur? What are you talking about?
DEET is fine. I personally feel like DEET is a little toxic.
Okay.
There are some new products. Picaridin in particular is a relatively new bug spray. Ranger Ready is one of the names. Sawyer is another. It works like DEET, but it wouldn't, like, I know some parents worry about putting DEET on their kids,
Exactly.
and so this would be a little bit safer.
So where do you put it, girl? Okay. Do you spray it on your legs, your cuffs? Do you spray it?
Are you talking about spray? You're wondering,
The bug
do you spray it
spray.
on your clothes?
Yeah.
So you can spray it on your clothes, but it's better to treat your clothes with permethrin. So you can do it yourself, or you can buy clothes that are already treated, or you can send them to a company called Insect Shield, and they'll treat them for you. The advantage of doing that is it would be good for 70
Well,
washes.
how long does that last?
If you do it yourself, 5 washes. So if you put permethrin, say, on your pants, then for 5 washes, it'll be good. And then you
So
would
for
need
me,
to
it would
redo
last 3 years.
Sure. Right. It would. They
Truth
say
be
if you
told.
just treat your shoes and socks, you will cut tick bites down 70%, because the vast majority of ticks come up from the grass.
So there's companies where you actually, at first you mentioned you can buy clothes already with pyrethrin in them.
Yes.
Why wouldn't you just take the insecticide 8 and just spray your clothes with it?
Well,
I know. There's different pyrethrins.
If you put bug spray, like if you put Picard on your clothes, it's going to be gone with the first washing. So it's not going to help. You don't put permethrin on your skin. That's why you use a different bug spray on your exposed skin.
So you're scaring the snot out of us, right?
But wait a minute. So
you just need to be aware.
Who are these companies that you send your clothes to?
So the only one I'm aware of is called Insect Shield. They sell clothes already treated, but they also will send you a bag, and you can put as many articles of clothing as you want in there, and you send it to them, and they will treat them. I think, to me, it seems reasonably priced. I think it runs about $150.
For whatever's in the bag?
For whatever's in the bag. Whereas if you bought a pair of pants already treated, probably going to cost you $80.
Yeah.
So it's a less expensive way, and it's good for families because I tell my patients, I'm like, get 2 or 3 outfits for your kids treated. Then you just instill in them, these are your outside clothes. When you go outside, you put these clothes on. When you come back in, you take them off and throw them in the dryer. And then maybe you don't have to wash them so often.
All right, we got to get out of here.
Yeah.
But,
okay.
So this is very interesting. That's such new information. I had no idea that you could have.
Can you hold on? We're going to go to a break.
Sure.
We got to pay some bills, but can you hang on for just a little bit longer?
There you go. All right, we're coming right back with more 93 WIBC. Hey, good morning. Welcome back. Pat Sullivan, along with Denny Smith. Terry's here. Allison is here. We have a very special guest that we wanted to hold over because we weren't quite done. It's Dr. Kim Lentz. Where can people find you?
So my office is located in Zionsville. Website is nhim.us is our website. But
and you only treat Lyme people with
Lyme disease and other tick-borne infections. Yeah,
okay.
We address all of them.
That's a specialty.
Are you the only one in the state with a specific to?
There are some others who do, but mine is probably the only exclusive practice. I do know other providers who.
So you don't deliver any babies over there?
I do not deliver any babies.
No,
I gave that up a long time ago.
You got into this.
I'm too old for that.
You had a family member who got it.
Yes.
And really didn't know what to do. You ended up in California.
Correct.
For training and then came back.
Yeah, my husband and daughter got sick, and we couldn't get anybody in the Midwest to take care of them, so we ended up having to go to California.
How far of a draw do you have? Do you have patients that come from a distance?
I have all the surrounding donut states. I have West Virginia, Alabama, Colorado, quite a few. I mean, it goes beyond just.
So if somebody has had chronic illness, is it a good idea? Then you could check them out. I mean, is there a test to say, yeah, you have Lyme disease?
Yeah, I use a test out of California that has been around really since the late 80s. By far the most accurate test. And so we do that a lot. It costs a little bit of money. But
because a lot of times people are searching for an answer.
Correct. That's how people get in my office most of the time. They don't know what's going on, but they've exhausted all other avenues. And then they end up saying, let's see if this is it.
Give me the website one more time.
nhim.us.
.us.
Yeah. It's New Horizons Integrative Medicine.
We also have a quick phone call question if we can take it.
Yep, let's do it.
Ron.
Ron joins us on the program. Hey, Aaron.
Yeah, I've got a real quick question. I've got an Aussie Doodle that I describe his fur like kind of like a Berber carpet. He's pretty much, he's a little over a year old, and it's real tight fur, but he likes to go under a pine tree. And I was wondering, with the tick situation, whether or not I need to treat him with any kind of a chemical or just.
Going to cut you off because we're going to run out of time.
He just needs his routine tick protection, whatever you do, if that's a shot or a collar. But I do tell patients do it year round.
Thank you, Doc. We're coming right back with more 93 WIBC.